Testing, all good? Yeah. All right, welcome everyone. Thank you for coming to our event here in lovely sunny Geneva. Welcome to those in person as well as those attending and joining us online. My name is Brian Wong and I'll be the moderator for this session today. A bit about me, I'm a digital health consultant currently working with WHO's European Observatory on Health Systems and Policies, as well as a few other hats that I wear, some of which you might hear about later. We're convening this event titled The New Era, and we're going to be discussing the role of AI and digital technologies for sustainable health systems. Now, as we know, across the world, many countries are really racing to harness digital technologies and data to improve their health systems. But for a lot of countries, this potential for digitization to advance health and the SDGs is not being realized. And that's largely due to digital divides, power imbalances within digital health ecosystems, as well as various inequalities. Now, in preparing for this session, we decided to consult an expert on what they thought the most relevant dimensions and implications of AI and digital technologies would be for health. It told us that, digital technologies are enablers for universal health coverage and primary health care, that they can be used and leveraged to address health disparities, that it's important to have, health literacy and patient empowerment when we're harnessing digital technologies. They can be used or can exacerbate digital divides. They can address and have implications for data privacy and security. We can have public-private partnerships that can come out of the harnessing of digital technologies. There are implications for capacity building of the workforce. And there's a really key role of young leaders in shaping the adoption of these kind of technologies, as well as there's implications for health financing. Now, what if I told you that this expert was actually ChatGPT? So as you see, when we talk to AI itself, it envisions this very comprehensive and robust role for digital technologies and AI when it comes to the landscape of health. But for the purpose of this discussion today, we're going to hone in on a few aspects. So firstly, digital technologies and their role as enablers for UHC and primary healthcare, how we foster public-private partnerships as we increasingly adopt digital technologies and AI, how we really build the capacity of the workforce as they're implementing and delivering and using these new technologies. And finally, last but not least, and one of my favorite topics, the role of young people. Young people's vision for and the role of them in shaping digital-first health systems as innovators. So without further ado, I'd like to kick off by introducing one of my mentors, Professor Lona Kickbush, who needs no introduction. She's a renowned global health expert. She co-chaired the Lancet and Financial Times Commission on Governing Health Futures 2030, which I had the pleasure of working on as a youth officer and now as an outgoing regional youth champion. And she also founded the Global Health Center at the Graduate Institute and is a visiting professor of the University of Geneva. So I'll hand off to Ilona. Over to you.
Thanks very much, Brian. And thank you for asking probably the oldest person in the room to address you here on issues related to youth. But of course, it's wonderful if you're a mentor and if you're in this situation to also see how young people make their way. Several people here in this audience were at some stage either my students or they cooperated in projects, etc. And now they're all over important international and other organizations. So this is really a very, very special treat and privilege to be around to see all this. So we are, of course, as Governing Health Futures 2030, really delighted to be co-hosting this event with HYPER and with the IFPMA. And we will see, and we also hope as we move forward, I'll say a word or two about that afterwards, that two powerful networks of young leaders are coming together here and that we have an enormous amount of potential in taking this forward, because just a couple of weeks ago, we have heard that we have received the funding to work on implementing and taking forward some of the recommendations that we have in the Lancet Commission. And that, of course, fills us with pride and excitement. And we'll actually be in the same building. So we're moving to the Centre Biotech for those of you here in Geneva. And so that water cooler effect, I think, will help moving the agenda forward. I mean, Brian has already alluded to it. We are really on the way into, or maybe already further than we think, into a new era for sustainable health systems that are being driven digitally. And even where the health system themselves have not digitalized enough, the fact that the world is transforming around them and becoming more and more digital by itself has an impact on those health systems. And of course, particularly as young people, you are very concerned with all the other crises that are going on in parallel. There's the climate crises. I don't need to talk about that at all. There's many financial crises. And of course, this has enormous impact on young populations as they find no jobs in many of the low and middle income countries. So that link into the enormous demographic transition that's going on is something that we really need to bring together more with the digital transformation. And because of this enormous demographic transition, I was able to be at the G20 negotiations on health in Goa a couple of weeks ago, and to think of millions of young people in Indonesia and Brazil, in many other countries, and that neither the universal health coverage approach really takes them into account, nor do many of the proposals of digital policies, digital health systems. The UHC policies and the digital policies are, we often criticize them for being gender neutral, but we actually have to start criticizing them that they are too demographically neutral. And particularly the investment in the next generation, both in terms of this digital transformation and the health transformation, is of course an absolute must. Some of the Indian colleagues were using a term we're perhaps not so comfortable with, but some of these countries, of course, speak of the youth dividend, and these Indian experts were speaking of the youth capital. They say, these young people are our capital. We have to invest in them in terms of health and of education, and we have to invest in them in terms of making jobs available. And again, the digital in its development, in creating totally new kinds of environments and jobs, particularly in the health sector, will be absolutely important. And is one of my dreams that as the health sector becomes more digital, it will actually become less female, because then maybe a few more boys will be tempted to take up this profession. So yes, the new era is digital, and it has enormous consequences for health professionals, and for the private sector. And therefore, as we move forward in taking the agenda of the Lancet Commission to its next step, we have said our priority is, of course, we need to be mission focused, and our mission is improved health and well-being of young people. But we need to, and we now have more freedom because the Lancet Commission very tight rules about, private sector and things like that. We need to have 3 groups of young leaders interacting to take this digital agenda forward. Young people through youth organizations, etc., whether you call them users or citizens or whatever. Then secondly, young health professionals. This is really very, very close to my heart, and we addressed it in the Commission's work. So many of the young health professionals are under 25, particularly community health workers. They are still, many of them, women. And actually, it's also, no matter what I said earlier, a fantastic opportunity for young women who are health professionals to get familiarized with the digital world. And we have many, many practical examples already that we will hear from, how this has really changed not only the lives of the women that are then served in the community, but of these women themselves who are digitalized through health and maybe also move on to other professions then, because they have gained these skills through being a digital health worker. So we want to push, and I think it's an absolute must in terms of the universal health coverage agenda, that we start building digital first health systems, and that we're very clear about the principles that we build them on and how they should be governed. And there's an unprecedented opportunity to do this, but I really have a plea to you, because if you read the papers, for example, that have now gone to the UN General Assembly for the high-level meeting on UHC, and if you might even have read the first draft of the political declaration that has come out, you would think you're actually still in the last century. And I do think this is really, really problematic. I'm aware that people don't want to change so much what they wrote in 2019 because they're nervous about political repercussions. And you know that this essential part of universal health coverage that we refer to as sexual and reproductive health and rights is not as popular at this point in time, and therefore many issues discussed around UHC are endangered because of this enormous rift. But I would urge youth organizations here in the room interested in the digital to really look at this very carefully and make the point, you know, we're all for these general principles of universal health coverage. And I was chair of UHC 2030. I'm still on the political advisory group. We're all about equity and inclusion and diversity and primary healthcare and all those things. And yes, we have to reiterate it again and again. But what does it mean at a point of major digital transformation, at a point where the digital divide is increasing other divides, and where we're perhaps going down a road where the positive potential of digital is actually being destroyed because we are not approaching it in a proactive enough manner. And that is for me absolutely critical. So to really urge you to help us who are active in this field and to take the lead to rethink health systems. You know, what are the health systems that you want? What are the health systems we need that to take the world forward, and to actually also make working in the health sector more exciting, more interesting, more satisfying, and to find a way where then through the digital, the voice of the users of these health systems are much more in the center. And so the way we approached the Lancet Commission was really, and we were the first Lancet Commission to include young people to the extent that we have. You might hear more about that as well. And we did surveys. You will find the reports, more details on those surveys in the publication. One always hesitates, you know, to put out a paper copy or when everyone's digital, but sometimes it's a very dense report. So my excuse always is, you know, we give you the sort of hard copy because it's so dense that sometimes it's easier to have it in front of you than on a screen. But we've obviously said clearly, if we say inclusive with all the other things that are usually said around inclusion and disadvantaged populations, indigenous populations, all of that, for us, this inclusiveness means meaningful involvement of young people. And not only asking them, what would you like, but really involving them in the co-design of these systems, because only then will these systems work. What will we work on as we take this forward? 3 areas. One, in the governance arena, there's obviously a number of key issues that young people have identified in terms of the protection of their data, the protection of their privacy, but also new forms of open source sharing and a concept that we call data solidarity. And we're taking this forward. The other area is the digital determinants of health that we will be taking forward. Think the concern of young people, the mental health impacts of much of the digital world. And obviously, you know, even I use ChatGPT. And I must say, we were writing an article on an editorial on the digital determinants of health. And I felt really bad after getting the description from ChatGPT what digital determinants of health are. I thought, why do I bother to write my own article, you know? So actually, we're referencing and giving credit to this wonderful work done here. And I think many of us will be doing this more and more. But the digital determinants are very important to us. And the third, as I said, is together with young people to develop digital first health systems and help develop this next generation of leaders. That's also a present generation of leaders to help us take this forward. Just 2 short things, and I will end with that. We are hoping to do. We already, during the time of the commission, and our commission fell smack into the COVID pandemic. So first of all, it helped us look at some of the issues with new eyes, but also in terms of our work, we truly had to become digital. But they did have some drawbacks because one of the things we were doing was building a network of African countries, the 10 African countries with the highest percentage of youth populations, to say, you know, is UHC actually there for them? Is the digital there for them? Are they involved? And so our first network that we're actively taking up now is these 10 African countries to move agendas forward. And the second is to work with those 10 countries that numerically have the highest youth population, which gives you a very exciting approach. And already the Brazilian G20 presidency has expressed an interest in that. So this is what we're out to do. I think you're going to have fantastic examples how young entrepreneurs, how young youth leaders and others are taking this agenda forward. And if we manage to develop a blueprint for sustainable and equitable digital first health systems, then we'll have done our job, and we need that sooner rather than later. Thank you.
Thank you, Ilona, for that excellent overview. I think you've really, highlighted a lot of the opportunities and challenges of digital transformations of health systems and UHC. Talking about equity, access, and meaningful youth engagement. And thank you so much for that really strong call to action for our audience here today, many of whom are young people. For those of you who aren't too keen on reading a dense report, we do have a youth version that's on our website, as well as a youth statement and call to action, which a lot of the components of Ilona's intervention are highlighted. So we'll move on, and we've got an excellent group of speakers here with us today. We're going to talk about how different professionals at different levels can influence and have been influencing the promise of digital health for universal health coverage, from primary healthcare level to regional level to private sector to global. And I'd like to now first start with our first panelist, who's Dr. Samir Pujari. He's the lead of AI and Digital Frontiers ecosystems for WHO in the Department of Digital Health and Innovation. He essentially leads all of their AI for Health initiatives. He also co-chairs the WHO and ITU, which is the International Telecommunications Union, focus group on AI for Health. And he's been with WHO since 2008. So you've seen this whole growth of digital health, through mHealth to big data to AI, where we are now, and you've set up several global initiatives. So I'd like to just ask you for your intervention. How does WHO's department that you're in support countries as they're harnessing digital technologies and AI to advance universal health coverage? Tell us a bit about your experience with this focus group on AI for health, some of the key challenges and opportunities you see, as well as some examples of successful digital health initiatives that you've done. And then finally, how WHO has been and is planning to engage young people throughout this process. Thanks.
Thanks, Brian. That will be next 1 hour and a half of my response.
And Samir has to do so in 5 minutes. So.
That's what is important. Let me get ChatGPT out of here. No, but thanks, Brian. I think these are very great questions. As you mentioned, the journey of digital is not new. And people often tend to get diverted toward technology too much. And very wisely put out, it's about the people, right? It's about who you're targeting. AI is a new enabler. We've had mobile health in the past. We've had big data, and they continue to grow. I think what is important is the focus to be on the human-centered approach, the people-centered approach, and how we can solve and make their lives better in terms of healthcare services. There is a massive opportunity. We've never seen computing powers as we have today in the space of AI, and that we have to leverage, which comes with a lot of sort of opportunities and challenges. I want to highlight it's not a WHO approach. This is what our bosses, the 194 member states, tell us to do. And we have a global strategy on digital health, which is 4 key strategic objectives. The first one is around collaboration. And I think that's what I want to call out again to everyone here is it's very important that we work together. We've often seen too many verticals happening, people recreating the wheel again and again. And I think what we want is to bring together and collaborate as much as possible. And that's an open call here, which the member states have said is going to be the primary approach of us going forward. The second is around actually implementing things. Let's not just talk about trying out things and then leaving for the fun of doing things. I think it has to be a sustainable approach to implementing and scaling. And I think that's where the call again is out here to see how we can work together to scale up implementation of programs of AI and again, keeping the center around the people part. The third one is actually establishing sustainable models. In digital, in most of and this is again in terms of how we can make UHC successful through digital as an enabler with artificial intelligence capabilities that we have today. We have to make sure that sustainable models are set in place through the collaboration, through the implementation that we're doing. That's the third objective. And the fourth is, again, make it human-centered. These are 4 objectives which are documented in the global strategy of digital health, endorsed by the member states. So I'm not making a new call here. This is something that we have been told by the bosses, the ministries of health and the countries. So let's work on that tangent as first part. The second thing I would like to mention about the experiences of what has happened. When AI comes to light, we look at ChatGPT, yeah, and there is a great model of LLMs that can be used. It's not new. It has been in the making for a long time. The possibilities have sort of taken to a new level. But we should again target the possibilities of AI for what gaps we have. I'll give you an example. Rural Africa, cervical cancer is a very expensive screen and treat model, right? We want, I mean, irrespective of whatever is happening, it's massively expensive. People are not able to reach, and women are dying because of very possibly sort of solutions that we have. AI, we've been working with several partners to see how AI-based interventions can reduce the cost and reach out to a maximized population. Very simple. It doesn't have to be fancy technology. It's just an add-on clip with an algorithm in the mobile phone itself, which can bring the cost from over $100 to $100. That's the scalability we're looking at with AI. So think from that angle as well. Diabetes, one of the biggest problems that we see in cities. How can we use the existing technology of image recognition to apply diabetic retinopathy? And there's evidence around it. There's science. We're not talking in vacuum here. We have science going around this. There's political commitment. We are seeing a huge amount of political commitment and opportunity. And there's a business market. So it's not a wholesale open market. So there's an opportunity for career to make this thing happen. So I think that's the other point I want to make as a highlight in the space of examples of where you can make a difference. The third thing is one question that people ask me is, what are the concrete actions that we need to take in terms of things? And I'll summarize this in very few statements. We have to make sure health for all is equitable, right? So the equity is a key part of it. How do we make it happen? We have to educate. There's still a lot of misunderstandings, misappropriation, and we need to educate people. We need to empower the innovators. We need to empower through the right regulations, through the right legislations, those innovators who can bring the resources, working with them again collaboratively. We don't want to keep it in isolation. So the second part is that. The third part is enable and enforce, which is important also, because we need to have the right regulations to make sure this is happening. So I think these are three important parameters that we need to work towards as a group. And let me say this again, we have changed. It is no AI or healthcare is not anymore just the government's job. It is everyone, each one of you working on it has to be actively pursuant to it, whether it's a climate issue that Ilona referred to, whether it's cancers, whether it's HIV, whether it's other topics that are happening, coming, even food. We're looking at a lot of evidence coming on food fortification domains. So there's an opportunity to enhance AI to the next level of things. So I think in summary, what I want to say, there's a lot of opportunities. I would summarize my sentence and make sure that everyone who's working on AI, what we want to see is making sure that we are cautiously optimistic and use AI in a responsible fashion. I think that's most important.
Great. Thanks so much, Samir. I also self-describe myself as a cautious optimist. So thanks for that. I mean, it's been really interesting to hear, the work that WHO is doing with this global strategy, the real importance of multi-stakeholder collaboration, and so that we're not working in verticals and silos, right? And then, your call to educate, empower, enable, and enforce. I think that's been really fantastic. Thanks. So let's move a step down now, and we'll go to the regional level. So I'm pleased to introduce my friend Jocelyn Carrias-Galliano, who's the general manager of RICAINSA. So Jocelyn's a project management specialist, advocate of digital transformation and digital health. She works with RICAINSA, which is an organization formed by Latin American professionals and volunteers, created with the intention of supporting national and regional digital health strategies, as well as generating spaces for these exchanges of best practice and experience to happen between public and private sector. She's co-created many different projects and initiatives aimed at professional women in the region as well. And she believes strongly that the participation of women is vital in order to guarantee the processes and development and transformation of human society. So Jocelyn and I have also had the chance to work together with some of the Transform Health initiatives, haven't we, on health data governance. So, and we've crossed paths a few times earlier this week. So I'm going to ask Jocelyn a few questions around, it'd be great if you could tell us your perspectives of the role of regional health informatics networks in promoting digital health solutions when it comes to universal health coverage, and highlight some cases from your region, and particularly in Central America, how they can work together to bridge digital divides and overcome barriers when it comes to implementing digital health solutions, like Samir was saying, and what RICAINSA is doing to empower young leaders in the region. Thanks.
Thank you so much, Brian. And as Dr. Samir says, I need an hour and a half as well.
5 minutes again.
Thank you so much for having us here. I think that the first question is super powerful because regional networks play a very important role in the digital transformation of our regions that impact globally. In the case of RICAINSA, as Brian mentioned, we are not only a network formed by partner organizations, but also is formed by people, by individuals. So that is our biggest strength, that we have in a space where professionals and technicians working on different projects or initiatives related to digital health can share experiences and best practices. And as you mentioned, Samir, collaboration is the key to generate a great impact. in the case of Latin America, that is a very diverse and unequitable region. And speaking in terms of digital transformation, it is as well, because we have countries with different levels of digital health and transformation maturity. So having the opportunity to gather together different organizations that are pulling the agenda and bringing the expertise of local and regional professional, give us the opportunity to bring technical assistance to the different organizations in countries in topics related to governance in digital health. That is a topic that we are strongly promoting, because we believe that in order to have digital health solutions, we need to have a strong legal regulations that can secure the rights of the people. So that is something that we have been supporting in the last 3 years. And we strongly participated in the development of the health data governance principles, that if you haven't had the chance to look at them, it is an extraordinary document where you can find how these principles that are based on the human rights in the rights of the patients, of the people, are trying to promote frameworks, a global framework that can protect the use of the data, of our data. So that is something that we do. We also, I'm gonna move to the second question. I told you I needed 2 hours.
You've got 2 more minutes.
Okay. Young people definitely are a priority in all the projects and initiatives that we are promoting in Latin America. We actually have a diversity, inclusion, and equitable digital health commission that is not also creating initiatives focused on young people, but also in women and indigenous communities and in other vulnerable groups. So in the case of Latin America, where young people occupy a very part of the population triangle, we are very committed to promote the change management, because we believe that having the interest of young people to get involved into STEAM careers, it is very important that they can begin to get the skills that they need in order to start developing and creating innovative solutions like the ones that we're gonna hear, and bring this approach to have to guarantee the solutions that we need in order to get to vulnerable communities. And solutions in Latin America and experiences, there are a lot. I would like to mention one, because I know that I only have a few seconds now. There is a very interesting project in Honduras that is promoted by a youth organization called ComSalud. They are bringing health services to the most forgotten community, indigenous community in Honduras, that is actually in the jungle of Honduras, that is in the border with Nicaragua, and they're through mobiles, cell phones, they are bringing healthcare to this community, and it's amazing how they started. And I can mention other initiatives. There are a few interesting experiences as well, led by young women that I believe it's important to bring the attention of all the organizations that are supporting them. Thank you.
Thank you so much, Josie. And hopefully we'll hear more about some of these initiatives later during the panel, during the Q&A rather. I think it's been really interesting that the regional perspective that you bring into this around the importance of closing digital divides and access. And we saw also yesterday the importance of measurement. We had the Global Digital Health Monitor launch as well yesterday, and that kind of highlighted the progress where some countries are when it comes to many of these aspects that Josie was mentioning, with workforce development, with infrastructure and capacity building. So yeah.
Thank you very much, Marianne.
Thanks. So let's switch gears now, and we'll go to Sarah Tuchever. Hopefully I said that right, who's the Digital Care Transformation Lead at UCB. And she is, that's a biopharmaceutical company headquartered in Brussels. She previously worked as a strategy consultant at Deloitte, where she focused on supporting European and international institutions, and has a big commitment to advancing digital health through ongoing transformation of patient care. So Sarah, I'd like to ask you a couple questions around how UCB is leveraging digital technology to transform care and improve patient outcomes. Some of the lessons learned from your experiences, and what strategies you might be using at UCB to empower young leaders like yourselves.
Okay, thank you so much. So first of all, thank you for having me here. As UCB, I'm really in strategy and implementation from a pharmaceutical perspective in technology projects, let's say. And we as a company, we're very committed to actually leverage those new technologies and innovation to, first of all, improve our science, improve clinical trials, as well as improve the outcomes for our patients. And on one hand, there's a lot to say about how research can be improved by the use of AI, but that's not what my team is doing. I'm more in the side where we look into what are the patient's problems that are most pressing at the moment, and are there any solutions with technology and innovation that we can use. And just to give you an example, right, we mainly work in neurology, immunology, and rare diseases. So to give you an example of what we do in neurology with epilepsy, for patients, a huge issue is the seizures, the unpredictability of the seizures. You can imagine what an impact that has on a patient's life and on the quality of life. So we're looking into what biomarkers or predictive algorithms could potentially predict these seizures, or at least some of these seizures, the worst ones. And how can we do that, and how can we inform the patients and all that. A lot of the work that I'm personally doing is more into diagnosis of chronic disease. And I think that's another area where AI can play a very big role, especially in the future. We're still trying to figure it out at the moment. But how can we find those patients that are currently undiagnosed? How can we give them access to care? And how do we make sure that, especially for chronic diseases, they get to the right treatment as soon as possible to make sure that they don't develop any worse conditions afterwards, right? Because that's often the case in chronic diseases. So just to answer on your other questions, for me, I'm really in the lead of partnerships, and it's been said before, like collaboration is so key here. The problems we're often dealing with in healthcare are super complex. And I always feel like everyone has a piece of the puzzle, and it's government, it's private, it's the technology solutions themselves, it's the patients. So, and the glue to bringing that puzzle together for me is always about how do we find that win-win situation? And it sounds much easier than it is, but how do we align all the incentives of these different actors and actually form that partnerships? I think that's the start of what I learned is really important to be successful in this sector. And then when it comes to implementation, what we learned as well, and what we are always forgetting, is we focus on the patient outcome and we really focus on what the technology is like, but there's so many people who undergo workflow changes when we implement a new technology. And the success of implementation really, for me, is all about how can we take those people along, nurses, doctors, patients themselves, physiotherapists. Like, how do we get the people on the ground actually convinced that this has value also for them and will improve their workflow as well? So I think that's, and in all that, like, youth leaders play such an important role. And I think my company is really playing also a crucial role. Like Brian mentioned, I come from consultancy. I had zero experience in pharmaceutical sector, yet company recruited me and just educated me and provided mentorship in order to get where I am today. I'm still learning every day because it's such a complex sector. I think you need people from different backgrounds working on that, and especially young people, right, who have like the passion to challenge that status quo and the passion to take some risks, which in the pharmaceutical sector, very risk-averse sector, can sometimes be interesting.
Awesome. Thanks so much, Sarah. It's really interesting to hear, your experience in the private sector and a call from the private sector for these partnerships. I think, a week and a bit ago, we had a health data collaborative meeting actually where we were talking about the importance of, stakeholder alignment to leverage some of these co-benefits that we're talking about, stakeholder alignment to bring people along. And we just had this high-level roundtable earlier today where we talked about, go to that community level, where that community health worker is going to be, and see what they want. So thank you so much for highlighting that. So we're gonna switch gears again, and I have the pleasure of introducing another one of my friends, Yifan, who's the chairperson of external relations at the International Pharmaceutical Students Federation, or IPSF. There's many of the delegates here today in the room. So Yifan is also a Canadian like myself. She led the transformation of the Imagine clinic into a virtual clinic in order to continue providing care during the COVID pandemic. And that was to help, bridge digital gaps for patients. And you're able to provide even internet and computer access to those in need. And it was, you'll tell us more about how it's been sustainable and it's still running. Another hat that Yifan wore was that she interned at a pharma tech company where she managed to create an automated flu form that also served 700,000 patients in Canada. So really looking forward to hearing from you. And so I'd like to ask you, as a young pharmacy professional, what were your experiences when we're talking about digital health? What role can pharmacists, some of whom are in the room, play in contributing and advancing this digital health agenda? And how does IPSF work to advocate for the inclusion of young pharmacists? We had that session earlier on AI education and pharmaceutical education, so perhaps you can allude to that as well. Thanks.
Thank you so much, Brian, and it's really nice to be here. I think you made my bio sound a lot more impressive than it actually is, but I'll touch up on these experiences. So I was the Imagine Clinic executive co-director as a student. It's a student-run interprofessional clinic where we provide care to vulnerable populations in Toronto, Canada. So during the pandemic, we had to be forced to shut down our walk-in and in-person services, but we wanted to continue providing that service. So we actually partnered with a private company to create an electronic documentation system so we could continue that piece. And we also enabled the clinic access with computer and internet for the population that we serve for, because sometimes they may not have the access or stable internet in terms of devices and information. So that's what we did. And I think it was very interesting for us to be able to step into that virtual role. And I think one of the takeaways is that as a young professional, we were able to kind of make this innovation with the population that we serve in mind. And I would like to say that for this, digital health has improved access to healthcare for many, but marginalized communities are often left behind. So it's important that we keep these populations in mind when we design these digital solutions so that we can continue providing care for all and leave no one behind. And then in the second kind of question, what can pharmacists do in terms of advancing these different agendas? I would like to say that as one of the most accessible healthcare professionals, community pharmacies are pretty much everywhere into the communities, even the most remote ones. So we are powerful implementers of public health initiatives. So one thing that I did at the pharmacy technology company was that we created this virtual platform that transformed the pharmacy model from a walk-in to an appointment-based model, because during the pandemic, we saw such a huge increase in terms of vaccine demand, and pharmacists could not really handle the walk-in amount of patient load. So this simple solution has actually helped a lot of pharmacists in terms of delivering their work, and also reduce the repetitive work in terms of documentation and scheduling patients in. So this was also another piece that I felt really important for. So in this piece, I think pharmacists, we are able to do a lot, and digital services can help us really simplify the amount of repetitive work that we can do, so that this can help us become even more effective and efficient in terms of providing these public health initiatives. And I know that these two examples are not really groundbreaking or anything, but it's important that digital solutions are designed for the communities that they serve for. So they don't have to be really fancy. They just need to be practical to solve a problem. And lastly, on behalf of International Pharmaceutical Students Federation, we do recognize that in our formal curriculum, there's not a lot of digital health or AI that's integrated, so that many of us, even though we're born into the digital era, we still have not a full grasp of what it could be. And as it's continuing to get into our fields, it's important that we grasp the foundational knowledge so that we can leverage the digital health. We can be a part of these innovations to serve the patients that we would like to serve. So, and sorry, one more thing, we do recognize that gap. So we're hoping to advocate for inclusion of digital health and AI into the formal curriculum through partnering with organizations that do specialize in these areas. Thank you.
Great, thanks so much, Yifan. And I think thanks so much for highlighting the importance of, sometimes, grasping those low-hanging fruit, because I think often we're so techno-solutionistic that we go for, all these shiny things, but that's not necessarily what's actually needed on the ground. And also for all the work that you're doing to advance and advocate for young people's involvement in the space. So let's switch gears one final time, and we'll go over to Konrad Tanku, who I've also met previously when at the World IP Day event that we did a couple of years ago. So Konrad's a medical doctor who's from Cameroon, and he's got a massive passion for technology and healthcare, and that led him to become a big name in the field of healthcare innovations. And he is the co-founder, he's the founder of GIC Space, and the flagship product of that is GIC Med, which targets breast and cervical cancers with various groundbreaking technologies. And you've earned numerous international accolades, one of which I was present for when you were awarded, right? It was the Africa Young Innovator for Health Award. So I'd like to hand over to you, and I'd like you to tell us a bit more about your experience founding this. What advice you might give to young innovators, particularly in your region, and kind of what the role of young leaders, are for promoting, your mission to promote digital health innovation and UHC in Africa. Over to you.
Great, thank you, Brad, and what a wonderful afternoon we have here. Before I start, I would like to build something on what Yifan just said, right? And paint a picture about challenges in the domain of healthcare first before talking about our GIC space. So we can all agree here that digital health has a great potential in reducing the gap in accessing healthcare, right? But one of the greatest risks we have is the enabling environment, especially in Africa, to be able to let the young people thrive in this domain. The unfortunate reality is that healthcare is competing with other domains, right? Fintech, agriculture, education, and what have you. If some of you who have traveled to Africa, you would have stumbled on something we call mobile money, right? And a lot of things have been done in the mobile money sector, right? A lot of progress. Now, if these young people who have access to health digital solutions have a lot to explore, are being confronted with a reality where healthcare has a lot of restrictions towards entry, then that could be a blocking barrier to enable these young people to access healthcare or to be able to innovate in the healthcare domain. I just want to paint an example, for example, build on what Yifan said, right? There is one of the French-speaking African countries where recently they officially banned the use of digital technologies in the pharmaceutical sector. Could you imagine? But we are preaching and we are showing a lot of great examples where this is bridging the gap in accessing healthcare, right? So I just wanted to pinpoint this as one of the risks we have, despite all the vibe we have, all the positive stories we have, that enabling environment, which is not still there, especially in the African domain, to help the youth to thrive. Coming to GIC space, just a small story how it started. So GIC actually stands for Global Innovation and Creativity Space. And the idea at the start was to create a space where anybody, right, any young person who is just passionate about innovation could get in, and together we can co-create solutions in the healthcare domain. And first of all, this idea came in because I started facing challenges before even starting this venture, because I could not find people to work with. There was the idea, there was the whole schema, the whole framework of how to move forward, but who do I work with? I'm a medical doctor by training. The first instinct was to get my most smart colleagues and then say, let's start this up. I had about 8 friends, medical doctors, and in less than 1 year, all of them convinced me to put this idea aside because it was so complicated, so difficult. As I mentioned, that's a reality of the healthcare domain. Sometimes these solutions, of course, they have the potential to create positive vibes in the healthcare industry, but there is a strong difficulty in able to kick off, especially in an African setting. If I can mention resources, for example, you're trying to build healthcare solutions, right? In the healthcare domain, you need resources to be able to brainstorm and understand the problem clearly. You need resources to be able to build the solution. And then you stumble on another situation where you need resources to carry out pilots, you need resources to carry out clinical trials to validate. Then you stumble on another roadblock, which is resources to be able to navigate regulation and then bring it to the market. How do you, as a young person, navigate all of this? Right? As I pointed out, despite all the positive vibes you could have, unfortunately, the healthcare climate, especially in the African domain, is setting out to be more of a blocking barrier to motivate these young people to get inside. GIC space, what has been a journey so far, right? We started with cervical cancer. The whole idea was to be able to build a solution where women in the most remote areas can have access to screening and diagnosis, right? At the beginning, it was about building just mobile solutions. But with time, we found a necessity to be able to integrate other technologies. And at this point, we've been able to add on hardware technologies connected to these software solutions where women now can be able to have access to screening and diagnosis, connecting the low-skill health providers who are present in rural areas to the specialized health providers who are present in the big cities. This has been working well so far. And I would say there were a lot of solutions we built on what we initially planned, based on the challenges we faced along the line, right? At the beginning, it was all about diagnosis. It was all about bringing care. It was all about detecting the disease. And when we had technologies which were working, marvelously, we discovered that probably there was a more critical problem. If our solutions were present in all health facilities, right? Now, who is going to let these women who need this solution to be able to be informed about breast and cervical cancer so they can move to the health facilities to get screened? We understood that there was another bigger problem in sensitizing and educating those who we potentially wanted to impact on what this disease is all about. And still, with our research and everything we've been doing so far, the solution or the best solution or the best approach has been in the digital domain as well. Be it designing digital solutions which can reach them directly, despite the other challenges which will come in terms of literacy levels which are diverse, language barriers or whatsoever, but the potential of digital technologies to be able to reach them at the last mile, educate them and mobilize them towards these health facilities to get screened has been marvelous in bridging this gap. And just to add on this, I'd say we have some sort of set the foundation of what we're about to build, but thinking far in terms of sustainability and making this type of solution to scale out, right, is what we're trying to reflect on at this point as well, because there are other pieces of the puzzle, as was mentioned as well, which we need to figure out, right? How are these women going to access this service? We are talking about universal health coverage, but in a context where healthcare accessibility is out of pocket, right? But still low socioeconomic level, low revenue level. How do we convince people to go access a healthcare service, which is not an emergency, right? When they have other problems to take care of. And still, as I mentioned, a lot of these things we are still trying to figure out, but yeah, the potential lies in digital technology. So we're trying to find out the best way to be able to access this. And I'd like to end up, Brian, by one other key aspect I'll say some sort of stumbled on and has been working out marvelously at our end so far, which is on the implementation strategy, right? We set out to leverage on the current healthcare system, but still another roadblock was about using healthcare providers who are already present in the domain. In the African context, when we talk about rural areas, health centers, you mainly find nurses who had, from our understanding, low knowledge about this breast and cervical cancer because they're mainly trained on primary healthcare, ANC, maternal care, child health, vaccination, and that was all, right? And we were bringing technologies which are new. How are they going to manipulate them? We set out to try to build it, to try to put in place a training model which could easily scale and empower these healthcare professionals. And I'll tell you, it took us up to 2 years, right, to be able to have the right model. We started piloting by a classic e-training model, which was like Udemy or Coursera, where we had a course where nurses had to like take a course over 2-3 weeks and then get empowered. We understood that these people as well are burnt out, right? They have other issues. So how are they going to sit down to follow a course when they have no clue of what it's all about, right? They're going to skip the stuff. We changed the model by coming up with another system where we could like change the whole course into videos, which can be more captivating and attractive maybe. And during one of our monitoring and evaluation events, we noticed that there was a particular situation where we tried to test the content, and there's a nurse who played one of the videos, and it was about a 5-minute video, and left for a while to attend to something else. And then came back at the end and said, wow, very interesting, very nice content. And the whole time we stood there, observed the nurse and noticed she didn't watch the video at all. And that's a reality, right? As we said, they are burnt out, they have other issues to take care of. How can we get the right strategy to train them? And that's where we fell on the third strategy, which was actually getting something more attractive, more interactive, and something more engaging with them. And that's where more recently we have been able to integrate interactive 3D simulations, which has been more attractive and more captivating for them. And I mean, it's proven to be more promising in terms of scaling this model and reaching every nurse, be able to empower them on, first of all, giving them the right knowledge and then the skills to be able to use their technology. So digital health is promising, but there are a lot of things we still need to take care of. Yeah.
Great. Thanks so much, Conrad. I think that was such an inspiring journey that you've highlighted, you know, all the challenges and roadblocks that you face. But I think, you know, your persistence is something that's really come through and you know, has definitely been worth it. So we're going to switch to our Q&A session now. And I'd like to invite Professor Lona Kickbush back up to the stage. So we've got a couple questions online that we'd like to address. We've also got a roving mic in the room. So we'll first take a question from online, and perhaps this can be to whoever would like to address it. And it's around how do we achieve this dynamic balance of multi-stakeholder interests in this digital health system? We talk so much about stakeholder alignment and the importance of that, but yeah, how do we balance those interests to avoid consolidation of interest patterns and ensure that systems are truly democratic? And that's from WHA76 online.
I'm happy to
Great.
shortly start. It's a really good question, and again, it's one of the key points to figure out before you can set up a partnership. What I learned, it's often about incentives on one hand, so make sure that all the incentives are aligned. So especially in the healthcare sector, it's often about reimbursement systems. How do we make sure everything is accessible, is sustainable? It's been mentioned before. So really make sure that nobody loses with the implementation of a transformation. So that would definitely be a big point.
Mira or Ilona?
I think you said very well, Sonia. I think she said very well. I mean, it's about the end product and it's a very difficult question to answer in one summary of everything, right? It's a different balance for different approaches that you do. The end objective is what are we doing for the people again? I mean, where is the benefit value that comes out of it? Responsible AI, which is or responsible digital approach, is the second part of it. So every stakeholder, whether is responsible enough to make sure that the end products are gunned towards the right objectives. I think that's most important in terms of collaboration. I personally don't think there's enough collaboration at any stage. I mean, it's always good to have bigger and broader knowledge sharing opportunities because you go faster that way. So the balance is only from the sort of the intentions, the bias that to avoid the bias and the right outputs that we want to look at.
Great, thanks. Ilona, would you like to say anything?
Yeah, I'd just like to pick up the point that Conrad made that to some extent, even before we talk about cooperation with others, the enormous difficulties there are within the health sector itself. And there is so much work to do there. Just to take the very practical example that in a country I know very well because of COVID, there were increasing Zoom contact between physicians and healthcare providers and the patients took it up and were incredibly positive about it. The minute the COVID was over, it was actually the health professionals who said, we don't want this anymore, not the patients. It obviously, you spoke about incentives, is partly related to the reimbursement system. But still, I think we really, really have to work on the challenges within our own system. And Conrad has explained them so well, and we must really tackle them together.
Thanks, Ilona. And Jossie, you wanted to say something really quickly?
Yes, I just want to add that digital health or digital transformation is not something exclusive from the health sector. We need to bring other sector as well, because we need connectivity, we need infrastructure, we need education. So it is important that countries can have a strategy that can bring all these sectors together. Thank you.
Thank you. We'll turn to the room. Do we have any questions here? Yes. Perhaps we'll take a couple and then we'll address them all together. And please do state your name and who you're representing.
Hello. First of all, thank you for this insightful discussion, and giving us this opportunity. My name is Iman. I'm 6th year medical student on behalf of IFMSA. I'm IFMSA delegate for the WHA event. During the hype of the virtual reality, there were lots of discussions and investments in this area, but the minute that this hype was over, all the investments went out. By the AI, we had like the same conditions, the same situations few years earlier as well, which there was a huge hype about AI and how we can implement, but after a while, the hype dropped down. So the question is, first of all, how do we know that this is not another hype situation at this moment? And second question that I had is, what are the concrete initiatives that health organizations on global scale has taken in order to be the leading leaders of the innovation and not just following the hypes and footsteps of the big companies like Amazon or Google or OpenAI? Thank you.
Thank you. Any others in the room? Yes.
Thanks so much. So I'm Basim, I'm a medical doctor, and now I'm shifting to data science. I'm having a startup in healthcare and mainly healthcare delivery. So it's really about delivering care to people. And our approach is really designing health system that is based on these technologies. So what I'm saying is we're developing a hybrid health system from the beginning that envision these technologies not as a transformer or enabler, but rather as the center, and then everything else we can imagine how can we use these technologies. So my question here is about how can we go from the paradigm that technology increase access to rather technology can envision better quality of care, not just in Africa or in low and middle income countries, but even in the health systems in Europe and other countries. Another thing that we noticed from our experience is that there's some countries who are low and middle income countries are having much better infrastructure and much better experience in digital compared to what we can consider more advanced health systems. And I hear very little about how can we learn from these countries. So these are my 2 points. Thanks so much.
Great. Thank you, Bassem. And Ajay in the front here.
Thanks, and really great panel, really interesting. My name is Ajay. I work at the WHO. I'm the lead for advanced HIV disease and of course work with Samir a little bit. So my question is kind of perhaps a departure, but I was just interested to know what the panel thought, which is when we're talking about digital technologies and AI, whether it's being used sort of by healthcare providers to improve care or by youth to interact and empower themselves with information, somebody is taking notes of that usage. So I think the question I had is, what are your thoughts on protecting those who are most vulnerable, who access this technology? This could be people with disabilities. These could be people on the autism spectrum. These could be young LGBTQ plus populations, because every time they make any kind of interaction with anything digital or AI, somebody is taking notes. So I was just interested in knowing, you know, what the conversation is around protections. And my second question was, it just caught my attention, so I'm asking, but it was the point being made about using technologies and rare diseases, which you were talking about. And the question here is that what's the model that's going to work there? Because it can go two ways. One is you're using a digital technology that can help reduce costs to identify this rare disease, but it can also go down the standard sort of pharma wormhole of we will charge an extraordinary amount of money because it can sort of identify this rare disease. So yeah, that was, yeah, so I want to know about that. And then also to your point, just to kind of perhaps kind of reiterate the point regarding cervical cancer, because that's something I've also been working on for a few years. I remember a healthcare worker actually saying, this is probably the first and the last time you will see this woman in the clinic. And I think just to kind of reiterate the point on how actually difficult it is. So I really wanted to commend the work that you're doing as well. Thank you.
Thank you, Ajay. So how do we ensure that's not too much of a hype? What are some great examples of initiatives? How do we leverage these country learnings, go from tech improving access to tech improving care, and then on the governance aspect of how do we protect those most vulnerable and address things around rare diseases? Who'd like to start?
Well, I'll just start with the learning, and our learning was from our commissioners and the Lancet that as we move into the next stage of the project, we constitute ourselves differently. And so we are now a consortium where we are here in Geneva, also because of all the international links. But the other key partner is at Ashoka University in India, wanting to make use of all the experience of India Stack and other experiences, and not just in digital health in quotes, but in relation to building digital identities, in learning from the Indian fintech, because that could have consequences, how you might build a more equitable insurance based on a different kind of financial model. So for us, it was absolutely central to have India. And then our third partner is in Nigeria to learn from those kind of examples. And I think that is absolutely critical. I must tell you, though, it's very interesting in the contact with funders. Many funders and sponsors are still in the old charity and development paradigm that somehow, the digital solutions are in the high income countries, and we're now going to go and bring them to the other countries. I'm sure you have that experience. And that is something we really, really have to work against. That's why I'm quite happy. Not every dimension of what India is doing is right. That's not what we're saying. But not everything, Apple is doing is right either, or what Germany is doing in its digital whatever. But that really there's quite a different approach to learning and listening that has to come into the conversations, and we've heard that from the experiences here. So I think your point, Bassem, is very, very important, and it needs a lot of change, really a lot of change. We always sort of say, and let's listen to the people and all of that, but many of the decision makers and many of the people that have the money are not listening.
That is
Thanks,
correct.
Lana. Josie, did you want to come in?
No, totally agree. And I mentioned that in my previous intervention. First of all, I think that in the case of Latin America, the countries have cleared that they need the technology in order to guarantee the access to their communities. But if you don't have, first of all, regulations that can guarantee the data of the patients, if you don't have policy makers that can advise the decision makers, it's going to be difficult. It's going to be difficult, and it is interesting what you mentioned, that you have seen how low and middle income countries have better infrastructure than others. And I mean, when you are there, I mean, you see that you need to, your struggle with other problems rather than health. We were speaking about this before we started the event, that you need to fight against violence, about education. So when you have these other kind of problems and you need to prioritize, because that is another thing, budget, national budgets, in order to bring the correct solutions. They need to start, the decision makers need to start making the smarter solutions. And definitely that there is where the role of local and regional experts can support the national strategies.
Great. Thanks, Josie. And speaking of solutions, Conrad, I'd like to move over to you.
Yeah, I mean, before I mention that, I would say also like to mention the mindset problem, right? So in the past, I think we have been conditioned, talking about Africa particularly, we have been conditioned a lot to have that reception, right, attitude. So I don't know if we have that juncture where the mindset has changed, where we think that we can stem up local solution and support those local solution at a national level, or we still need to keep on waiting for things to come in and then we're implementing. So that's at the national or ministry level. If the mindset changes, then I think things are going to change. If we still have the backward mindset of reception, that I don't think things are going to change. And just to mention the aspect about cervical cancer, I would say trying to put in place the right implementation strategy, I would say that was the biggest work we had to do, right? And one of, just to answer your question in the direction you mentioned it, right? It was actually to be able to implement that, to integrate that into the normal workflow of the hospital, right? If a woman gets into the hospital to vaccinate a child for polio, for example, then you should be able to put in place a system where you can provide or propose another service and then be able to capture them. Because integrating that into other services that already exist can be able to bridge that gap as well. Same thing, the sexual and reproductive healthcare package, you integrate cervical cancer screening, can make a lot of sense than just talking about HIV. That can bridge that gap.
Thanks so much, Conrad. And maybe Samira, if you'd like to come in on leveraging these kind of country learnings and what do we do when it comes to actually implementing some of these solutions?
Yeah, I feel some of the questions were really directly pointed to me. So the question to us. Let me start off. And again, let me start off first saying that I'm really humbled to see such intelligent questions coming from the audience. I mean, this is really, great. We did a social media live this afternoon also. Even across the globe, the questions that are coming are really apt and practical. So it's important to get to that level of understanding. Now, let me go point by point. So VR versus AI hype. So typically in an innovation cycle, hype comes up first, right? And so there's this peak you'll see at a stage, and at some stage when the reality hits in and the science starts creeping in, you either fall apart or you start building that curve along. I think in terms of VR, we probably had a gap in terms of the science that came out of it. Whereas in AI, we are seeing a peak of science that's growing in. And I think that's the difference between the question. I mean, I'm not saying that AI we are on it, there is a potential science that's growing with the possibilities that we're coming out. So that's a very realistic answer, where today's stage AI is showing positive scientific evidence, and that's why the political commitment is coming in. VR were different parameters, and we never know, there might be innovations in VR which might come back to stage. So that's, I think, the one part of the question. In terms of the point that was made on quality of care, and how do we enforce it? I think the most important part is responsible AI and the ethics of how it's delivered, right? So the governments, let's not point a finger to the government and say, just you have to do everything. It's everyone, right? From the developers to the users. I was on the social media live this afternoon and someone said, what if AI misdiagnoses me? And my point was, yes, you don't go and ask AI for a diagnosis, right? So it is an additional, it's an augmented intelligence that we're looking at, but you need to have the human intelligence behind it to support that. So I think the ethical principles have to be there, trust in AI, white box AI as we're calling it now. It's not, we don't want to see the black box AI terminologies in there. Right data sets behind it are critical to see the validation. And then once they're validated through an open channel, then that's where we can have a much more trustworthy component.
Samir, I'll cut you off there. I just want to bring in Sarah and Ifan. Sarah, perhaps over to you really quickly.
Yeah, maybe I can comment on the rare diseases. So rare diseases is a very interesting market because usually, you know, the investment to get a drug on the market is pretty huge. And if then your actual market is super small, it's high risk for a pharmaceutical company to go for. But I fully understand your question. So how we work is usually we already have a treatment out there and it's already been negotiated in terms of pricing with the government before we even start these innovation projects, right? Our objective is really about there are patients out there, sometimes also with very limited access to care, who have these horrible diseases. It's like I wasn't even aware that so many horrible diseases existed. And how can we just make sure that these patients are identified and if possible, get to the right treatment as soon as possible? And yeah, it's very painful to see sometimes the damage that the disease already did to people while there is a treatment out there that could potentially serve them. So I think AI could play a gigantic role in that, and governments should also support their patients then with the reimbursement needed for that, yeah, to make sure that they get the treatment they need.
Right. Thanks, Sarah. And finally, over to you, Ifan.
So I would like to address the question regarding how do we protect the people who are accessing these digital health and AI services. So I think this is where, from a healthcare provider perspective, it's really important that we position ourselves as either champions or knowledgeable experts in digital health. Because if you think about it, patients sometimes have questions about their health. And if they don't think that you know about these different digital technologies, digital health and other applications, for example, then they wouldn't come in to ask you the questions. They would just ask it themselves, and they wouldn't think that you know if it's right or wrong. So if we position ourselves and if we educate ourselves in learning all of these different digital technologies, then we can come in where patients, when they come into us, we can educate them on digital literacy, on how to identify information that's correct and how to leverage these solutions when it's appropriate versus when it's not appropriate. And I would like to kind of link back to the importance of digital health and AI in our curriculum so that we can all be kind of empowered through our fundamental education phases. So yeah, thank you.
Thanks so much, Ifan. So I think we'll end it there. Thank you all so much for being with us today and for bearing us going a little bit over time. I mean, I think we've heard such incredible examples from global to regional to pharma to young people, young innovators, and healthcare professionals, and also the importance of meaningful youth engagement as young leaders like many of yourselves in this room are applying digital technologies, data, and AI in their practice to accelerate universal health coverage. So if you wouldn't mind just giving a round of applause to our amazing panelists here. And just to say that we have a reception now just out there, outside on the terrace, where you'll get the chance to mingle with some of our amazing panelists. And would just like to thank you all for being here again. So thank you, enjoy.